that the cause of this is going to be the inability of the Republicans to compromise, because we have said we're willing to do that.
23 past the hour, a live look at Capitol Hill, the sun coming up over Washington. And joining us now from Capitol Hill, Republican Senator from Oklahoma, Senator Tom Coburn. And from Washington, NBC News Capitol Hill correspondent Kelly O'Donnell back on the show.
Now look at
Good
them.
to have you both.
They're both wearing green.
I know.
Yeah, where's yours, Joe?
Someone had to. I noticed you two didn't come up with that today.
No,
My green.
Joe had a tie.
I'm wearing a green tie right here, Tom.
Look at Senator Coburn.
Look at that. It's a green tie, Tom, and I'm wearing a green tie too. And I tied it just for you, Tom. So anyway, hey, Tom, Harry Reid says we got no problem with Social Security.
All good.
Says all good, and it pays for itself. In fact, we're not going to run a debt on Social Security for 20 or 30 years.
You must not care about people on Social Security.
Yeah, why are you so mean, Tom Coburn?
Cold-hearted.
Well, Joe, you helped the Congress steal the money from it and spend it.
Yeah,
it's all gone.
It's all my problem. You know, the thing is, Tom, back in '98, I think it was, we actually had started to move the Congress to actually put the Social Security Trust Fund to the side and pay it.
Yeah.
And we couldn't even get that done back in '98. Yeah. The situation's gotten so much worse. Could you give Americans the numbers that explain why Harry Reid is so wrong?
Well, yeah, real quickly, we have stolen $2.6 trillion from it. We put paper money in there, but the problem is we spent the money. We didn't just take it, we took it and spent it. Social Security ran about a $53 billion deficit last year. It's projected to run a continuous deficit. So there's no question that there's an IOU in there. But our problem in our country, borrowing $4 billion a day, which is what we're doing, is we got to create a realistic expectation by the people who are loaning us money that we're going to solve our problems. And there's no question, if we had the money, we could wait 10 or 15, 20 years to fix Social Security. But because we don't have the money, and we're going to have to borrow the money, we have to create an environment where people trust us. So they're saying, this thing's on the downstream, you better fix this if you want us to loan them the money. And they're missing the point. We can keep commitments, and we can give some proper expectations to young people in terms of Social Security, and we can not take in, we can actually enhance those that are on the low end, which is what the Deficit Commission did, and fix Social Security. And we don't have to raise the first tax to do that. It's all through delaying the time at onset and creating the proper expectations. But you cannot borrow the money this country needs. Remember, you know, PIMCO got out of U.S. bonds last week. That ought to send a big signal to everybody in this country that they're worried about us. They're the biggest bond trader in the world.
Wow.
Well, then I don't understand why Harry Reid would say what he said.
Such a thing?
What do you think I don't want to be cynical and think it's just political strategy. I mean, what would be behind such statements, Senator?
It is political strategy. When you take the Democrats' base, if 74% of their base now says, we want you to cut spending, well, that's not any different than the conservative base. 74% of them want us to cut spending. So where do you hang a difference between Republicans and Democrats? It's got to be that we hate little old people who paid into their Social Security and want to take it away from them.
And you're going to take their medicine,
you know, it's a farce. The fact is we're not going to solve the very real problems in front of our country today. And I want to tell you, they're gigantic. And we may not solve them anyhow, but we're not going to solve them with people playing political games to try to create a political advantage. The president hadn't really done that yet, but it needs to stop, and we need to come together. If American people understand that we have big problems, and that's given to them in a way that realistically says we have to act, the American people will come together and we can do the best thing for the country. But if we play the game of partisan divide and gotcha politics, what we're going to do is go down the tubes.
Kelly O'Donnell, first of all, I commend you as a German, with somebody like a German name like O'Donnell.
Yeah, really.
To still be wearing green this morning.
That was nice of you.
We thank you for standing shoulder to shoulder with your Irish brethren. But what is Harry Reid up to here? He knows that he is in a shrinking minority of people with their head in their sand pretending that entitlement programs don't need to be fixed. Is this just posturing for the grand bargain?
Some of it's a bit of an echo of the really rough campaign he went through in 2010, where Social Security was a very big issue in his home state of Nevada, which of course has a large number of seniors who live there. And so it is one of his core issues. And as Senator Coburn talks about, there's this real concern about how involved will the president be. Now, Senator Coburn's one of the Republicans with a better relationship with the president than most, has more contact with him than most. And I'm curious if Senator Coburn has a sense of how much the president would be willing to step forward in this. I know you've pressured him to want to do that, at least I'm assuming privately, but where do you think the president stands on this?
Well, I keep wondering when we're going to have the grand bargain and come together. You know, the fact that the debt popped $72 billion yesterday, which makes us about $60 billion away from the debt limit, it's time for them to engage. And I think this president will do the right thing when it gets down to it. I just want him to do it sooner rather than later. I know later gives him more political advantage, but it hurts the country. And, you know, if he'll stand up and lead on these issues, I think the American people will follow him.
John Meacham.
Senator, a lot of folks have wondered why both parties haven't been more eager to embrace the Simpson-Bowles proposals, wondering where you stand on that.
Well, look, it's hard for both parties because they have this hard contingent on each end that says, no, you can't do these things. And the point is if Republicans wait to get 60 Republicans in the Senate, which may never happen, we're down the tubes. If the Democrats wait to get 60 again to get their way, it may never happen. The fact is we need to do the best thing we can with the country, for the country. And people don't want to take it because they're going to get shot at. Look, I've been shot at from every direction you can because I voted for Simpson-Bowles.
All right, so I was just looking at the full screen they put next to you with little factoids about who you are, Senator, and you've delivered over 4,000 babies.
Yeah,
that's a lot of babies.
Probably the best experience of my life is to watch the eyes of parents as they see their new child come into the world. It is just a phenomenal blessing and experience to be able to participate in that.
All right, so let's then talk about health care.
Don't ask him the worst experience, because I've heard him say that it was actually meeting me.
Well,
so you get both ends of the spectrum.
Stop.
There.
He wouldn't want to say that about you on the air.
Yeah, but at least he didn't have to meet me 4,000 times. No. So anyway, what's the question?
That would be
actually, Joe, every baby I delivered, I gave a spanking to. Yeah.
I love it. Okay.
Does he do that when he meets you?
Oh, God.
No,
okay, we digress.
Come on, let's go.
All right, so the year anniversary of Obama signing the health care bill into law is next week. You, sir, are working on the repeal. Is this really, at this point, what we should be doing, and is it going to work?
I don't know what it's going to work, but I can tell you this bill isn't going to work. Look, our problems with health care, there's no question there were some access problems. But the big problem, the reason people don't have access is because health care costs too much. And this bill didn't fix the underlying problem of health care, and that's cost. And you can't fix it with a government agency mandating what the prices are going to be. If that was the case, Medicare would be in great shape. What we have to do is reconnect consumer purchase with payment. And if we'll do that, a lot of this will fall away. You know, I give the example, you know, I've delivered about 400 Amish babies. They don't have health insurance. Most of them don't have a college education, but they buy their health care at about 40% less than the best insurance company. Why is that? Because they come in and negotiate cash payments in advance, and they ask a question about every test that's ordered and every procedure that's done, and want to know why you're doing it, where they can get it done cheaper, and make sure it has to be done. So they're discriminating consumers when it comes to their health care. Well, that's where we need everywhere. We have almost $1 trillion waste in healthcare. It's $850 to $950 billion in terms of waste every year in healthcare that doesn't help anybody get well and doesn't prevent anybody from getting sick. So if we really want to fix healthcare, what we have to do is take those drivers out that cause us to spend money that doesn't help anybody. And there's several good studies out. There's a new study just released on that by the Institute of Medicine, by of all people, the federal government's Institute of Medicine, which says there's $800 billion of absolute waste that doesn't help anybody. Well, that's a third of it. That's a third of every dollar. So if we worked on that, we could drop everybody's health care cost by a third. Do you think health care would then be the factor it is?
Do you?
I think you make a lot of sense, but I think repeal is going to be a waste of time, and we've got other things on our plate right now.
You're not going to repeal it until there's a different president.
Exactly.
But you at least I have not spoken with many people on either side of the political divide who think the health care bill that passed last time is the answer to our problems. Even
well,
close
privately, they admit it's a mistake.
Yeah.
What we have to do is give them a way to save face and change it.
All right.
Senator Tom Coburn.
Tom, thank you.
Thank you very much.
Good to see you guys.
Can we
Take
hold
care.
Kelly over? Because she's so great.
I know, she's
and
awesome.
you only let her answer one question.
I'm sorry. Kelly, can you stay? I apologize.
I can sit here, sure. I've got a cup of
stay
coffee,
another
no
block.
problem.
You got your coffee. Coming up, Louisiana Senator Mary